Herniated disc. A herniated disc occurs when one of the discs in your spine or backbone tears or leaks due to natural wear and tear or injury. This puts pressure on your spinal cord and irritates your spinal nerves, leading to pain, numbness, and weakness. You have a series of bones or vertebrae in your spine, stretching from the base of your skull to your tailbone. Between your vertebrae are round cushions called discs. The discs act as buffers between your bones, allowing you to bend and move with ease. Over time, the discs become less effective and may become displaced. When this occurs, it's called a herniated disc. Other names for a herniated disc include 1. Bulging disc, 2. Slipped disc, 3. Ruptured disc, 4. Protruding disc. Bulging discs are a leading cause of neck, back, and leg pain. It can happen anywhere along your spine, but they most often occur in your lower back called lumbar spine or your neck called cervical spine. It's rare for a herniated disc to be in your upper tumid back or thoracic spine. Symptoms of a herniated disc in your lower back or herniated lumbar disc. It's common for a herniated disc in your lower back to cause sciatic nerve pain or sciatica. This sharp pain usually shoots down one side of your buttocks into your leg and sometimes your foot. Other symptoms of a slipped disc in your lower back may include 1. Lower back pain, 2. Tingling or numbness in your legs and feet, 3. Muscle weakness. Symptoms of a herniated disc in your neck or a herniated cervical disc. Symptoms of a bulging disc in your neck may include 1. Neck pain, especially in the back and on the sides of your neck. 2. Numbness or tingling in your arms. 3. Pain near or between your shoulder blades. 4. Pain that travels to your shoulder, arm, and sometimes your hand and fingers. 5. Pain that increases when bending or turning your neck. What causes a bulging disc? Each disc in your spine has a soft, gel-like center and a firmer outer layer, kind of like a jelly donut. With time, the outer layer weakens and can crack. A herniated disc happens when the inner jelly substance pushes through the crack and presses on your spinal cord. The leaked material may press on nearby spinal nerves, causing the symptoms of a herniated disc. Several factors can contribute to a disc rupture. Herniated disc causes include 1. Aging, 2. Traumatic injuries like falls, 3. Performing repetitive bending or twisting motions. For improper lifting of heavy objects, what are the risk factors for a slipped disc? Where people ages 30 to 50 are most likely to get a herniated disc. The problem affects men twice as often women. In addition, the condition tends to run in families. Other risk factors include 1. Smoking, 2. Sitting for long periods in the same position, 3. Having overweight or obesity, 4. Having diabetes, 5. Having a connective tissue disorder. How is a herniated disc diagnosed? Your healthcare provider will do a thorough physical exam. During the exam, your provider will assess your pain, muscle reflexes, sensation, and muscle strength. They may perform a straight-legged raise test. With this test, your provider will have you lie on your back. Then, they'll raise your legs straight in the air. If you experience any pain down your leg, you likely have a ruptured disc. Tests diagnose herniated disc including 1. Magnetic resonance imaging or MRI scan, 2. X-rays, 3. Computed tomography or CT scan, 4 mg, 5. electromyogram or EMG. 6. Nerve conduction study. Management and treatment. In most cases, pain from a slipped disc goes away in time. To ease pain while your disc heals, you can 1. Rest for 1 to 3 days if the pain is severe. But it's important to avoid long periods of bed rest to prevent stiffness. It's take an over-the-counter pain reliever like ibuprofen or acetaminophen. 3. Apply heat or ice to the affected area. What is the treatment for a herniated disc? You may need more advanced herniated disc treatment if your symptoms aren't getting better. Your healthcare provider might recommend 1. Medication. Your provider may prescribe an anti-inflammatory pain reliever or muscle relaxant. To physical therapy, a physical therapist teaches you a fitness program to help relieve pressure on your nerves. Physical activity loosens tight muscles and improves circulation. 3. Spinal injections, called an epidural or nerve block. A spinal injection is a shot of steroid medication directly into your spine. When should I go for herniated disc surgery? Herniated discs get better on their own or with non-surgical treatment for 9 out of 10 people. If other treatments don't relieve your symptoms, your healthcare provider may recommend surgery. There are multiple surgical techniques for relieving pressure on your spinal cord and nerves. In rare cases, a large ruptured disc might injure nerves to your bladder or bowel. That may require emergency surgery. For non-emergency cases, herniated disc surgery is an option when other treatments don't work. There are various ways to perform spinal decompression surgery, but the goal is to relieve pressure on your nerves. The most common procedure is called a microdiscectomy. With this minimally invasive spine surgery, your provider will make a small cut incision through the skin near the slipped disc. They'll insert a microscope and small tools through the incision to remove the herniated part of the disc. Other surgical treatment options include 1. Discectomy. Discectomy, sometimes spelled discectomy, is a surgery to remove part or all of an intervertebral disc in your spine. 2. Laminotomy. Laminotomy is surgery to remove a piece of your lamina. The lamina is the back part of a vertebra in your spine. 3. Laminectomy. Laminectomy is surgery on your spine to remove the lamina. For artificial disc surgery, artificial disc replacement surgery involves replacing a damaged spinal disc in your spine with an artificial or prosthetic disc. 5. Spinal fusion. Spinal fusion is a surgery that connects 2 or more vertebrae in your spine. How long does it take to recover from a herniated disc? For the majority of people, herniated disc pain gets better on its own, or with simple medical care. You'll probably feel better within a month. If you don't, you should see a healthcare provider. Some people need more aggressive medical measures like spinal injections or herniated disc surgery. Will a slipped disc get worse? An untreated herniated disc can get worse. That's especially true if you continue the activities that caused it. For instance, if it developed because of your work. A worsening ruptured disc may cause chronic pain and loss of control or sensation in the affected area. See a healthcare provider if you still have symptoms after 4 to 6 weeks of conservative care. Prevention. It's not always possible to prevent a bulging disc, but you can reduce your risk by 1. Using proper lifting techniques. Don't bend at the waist. Bend your knees while keeping your back straight. Use your strong leg muscles to help support the load, to maintaining a healthy weight for you. KSS weight puts pressure on your lower back. 3. practicing good posture. Learn how to improve your posture when you walk, sit, stand, and sleep. Good posture reduces strain on your spine. For stretching, it's especially important to take stretching breaks if you often sit for long periods. 5. Avoiding wearing high-heeled shoes. This type of shoe throws your spine out of alignment. 6. Getting regular physical activity. Focus on workouts that strengthen your back and abdomen muscles to help support your spine. 7. Stopping smoking. Smoking can weaken discs, making them vulnerable to rupture. Consider quitting smoking. When should I see my healthcare provider? Initially, you can treat ruptured disc pain at home. But you should see a healthcare provider if 1. Pain interferes with daily life, like going to work. 2. Symptoms are not better after 4 to 6 weeks. 3. Symptoms get worse. 4. You develop loss of bladder or bowel control. 5. You notice tingling, numbness, or loss of strength in your arms, hands, legs, or feet. 6. You have trouble standing or walking. Thank you.